Welcome back, ladies and gentlemen. This is Dr. Pickens here. And a lot of people come to me complaining about their eyes. My eyes are making me look old. I don't like the way my eyes look. My eyes have lines and wrinkles. Well, first, let's narrow it down to what is it about your eyes that is bothering you. Now, if it's color, uh, on dark circles, or you're feeling like your eyes have a tint to it that doesn't match the rest of your face, well, we can combat that with skincare products that you can purchase and use at home. And we can show you how applying those types of products for skin brightening can help brighten up the dark circles around the eyes. A lot of times they're hereditary or maybe associated with allergies, or conditions that are related to causing hyperpigmentation. So that can be corrected if you are patient and if you are consistent with their use. Now, if you are concerned about lines and wrinkles around the eyes, well, what we can use for that is injectables. And there's Botox, Xeomin, Dysport, Jeuveau. So just for the simplicity, I'm going to refer to all of those as Botox, whatever brand it is, they all work the same. And what I would recommend for that problem is just a little bit of Botox to help with the crow's feet. And that's from squinting or smiling or, laughing. That can cause over time the lines on the face. And you don't want to wait until they get to be lines on the face when you're not moving your face, because then it may take a little bit more than just those types of products. But you want to do it when you see the lines when you are smiling or laughing, or squinting. So to prevent those deep etched in lines. Now that can be taken care of quite simply in a matter of a few days, to be honest, and prevent it from getting deep, etched in. And so that can be helped with just a little bit of Botox. And then they'll never have to be as deep as you have seen them before, as long as you maintain it. And usually Botox will last about 3 to 4 months. So in a week, those can be softened and have you having a more youthful eye. Also, you can put a little bit underneath. That's an advanced technique that I've been doing for over a decade. And that can actually help to open your eyes a little bit more so they don't look like they're closed. Now, we can get a brow lift for those of us maybe a little bit older who are having some hooding, or the skin of the upper eyelid seems to be drooping a little bit and it makes your eyes looking like they're closed, or giving you less room to apply your eyeshadow and making you feel like your eyes are looking older. Well, we can do that by elevating the brow a little bit with some Botox or those types of products. So we've been doing that for years. So that's not that difficult. It's really not that costly, but it does need to be maintained. So now, if the problem that you are concerned about is your eyes have bags, or conversely, the eyes are sunken, we do have fat pad shifting as we age. So the fat pad on the lower lid can herniate and cause bags, and they will appear worse in the morning because of gravity. After we've been lying down, then fluid goes up to our head. They are more accentuated in the morning, and with salt intake, which draws in water, and look a little bit better later in the day or in the evening, or with ice packs. So those are some things that you can do naturally. Reduce your sodium intake and apply ice packs. So, and maybe taking some allergy medication, or avoiding exposure to things that you are allergic to. Now, once that has been done, and if you're still seeing the bags and you don't like the appearance, we can, I use a lot of PRP, or platelet-rich plasma, or platelet-rich fibrin, can be used, which is actually sourced from your blood, but you just draw on your blood. Usually one tube of blood is sufficient, and we can have that applied topically through microneedling. Microneedling stimulates collagens to tighten the skin of your lower lid, which can become loose and sagging. And with that, skin laxity can cause you have an aging appearance to your eyes. So when we do that, we can sprinkle a little bit of your plasma on top so it sinks through the openings that are created in the skin from the micro needling, and you can watch that on my website. Kind of like aerating your lawn. You know, the channels that are creating in the lawn have an opening through which you can put fertilizer. So the fertilizer in this case is your blood plasma. So that is one way. And the other way that I use is PRP injected right in the lower lid. And that can stimulate collagen production in your own body. And that plasma is injected. You may need one or two depending on how bad the appearance is. And also we use filler there sometimes, but I tend to use a lot less filler now and more plasma, but we can use filler. And actually the filler, it can be used to build up the fullness or the volume in the cheeks. So the upper cheek area or the side cheek area and the cheekbones, that can help to camouflage the bags or the sunkenness in the eyes very, very nicely. So those are a few things that we can do professionally, and that's what this second video about how to have a youthful appearing eyes is all about. The first video was talking about things that you can do at home for yourself, and then these are methods that we do to help professionally in the office. Now, the last thing that I'm going to mention is radio frequency. Radio frequency is a method of applying through a device heat to the face to stimulate collagen production and thereby tighten the skin. So this can be done not just for eyes. These things like microneedling can be done, and the radio frequency can be done for the entire face. But right now we're just talking about with eyes. And of course, home care would involve skincare products as well as eye creams. So eye creams can be effective, and not only for treatment but for maintenance, for discoloration, and for tightening the skin and helping to smooth out the fine lines and below the eyes. Also, chemical peels can help smooth out the fine lines and the lower lids as well, or even the crow's feet. So I hope you find this helpful. Please like it or give me a thumbs up in the comments, or letting me know if this was helpful to you. Please subscribe, and please visit the website so you can see videos of some of these procedures being performed. Thank you for watching.